Okay, good evening, everyone. My name is Janet Forrest. I'm one of the adult program coordinators at the Nantucket Athenaeum, along with my colleague, Sammy, who's also on the line here. And we're very excited for this One Book, One Island conversation around mental health and substance abuse and suicide. Without any other further ado, I'm going to introduce our panelists and ask them to introduce themselves. So Amanda, I'm going to start with you. Would you introduce yourself? Amanda?
Sure. Hi, everybody. My name is Amanda. I am the clinical director at Fairwinds, Nantucket's Counseling Center. It's nice to see you all.
Okay, and I'm going to go to Allie next.
Hi, my name is Allie Anderson. I'm the Chief Clinical Officer of Gosnold.
Okay, thank you. And Sue?
Good evening. I'm Sue Mintonen, and I am the co-program director for NAMI on Nantucket.
Okay. And last but not least, Jason.
Thank you, Janet. My name is Jason Bridges. I'm the executive director of Fairwinds.
Okay. I didn't miss anyone, did I? Okay. Great. So I wanted to start by going around and asking each of our panelists to talk about what they think some of the myths are around suicide, and even if you want to chime in on how you thought it was reflected in the book. So Amanda, I'm going to start with you.
All righty. So I think one of the big myths about suicide is if you're concerned about someone and you want to ask them the question, are you thinking of killing yourself? People stop to think and be like, if I ask that question, I'm going to put the thought in their mind. And I want to let everybody know that this is not true, that it's almost a relief for people when you ask a very direct question, like, are you thinking about killing yourself? Because that thought is already in their mind. And for them to be able to hear that question being asked, it shows that you care and that you're there for them and you want to try to help them.
Jason, why don't I go over to you next?
Well, Amanda took that one from me because I've been involved in a lot of the QPR training that we do about how to see the signs of suicide, what to do about it, to give people the tools, more as a bystander and a supporter of staff. And I think the one that stands out the most when I just see people's body language is what Amanda just said, of that hesitation to say anything, that you're going to bring it up and push them maybe over to that edge. And there's no research that shows that. And the state doesn't support that either, with, whether it's DPH or DMH. And so they really push to engage. And I think that's scary coming from if it's your family member or a friend, you don't really want to take that risk. But I think the more you read and more understand that that's not the case, it'll help push you over. It doesn't really relate exactly to this book because it was kind of one person in a metaphorical library. But that's really, I should probably pick another one, Amanda, but to me, it's the biggest hurdle to get over when you're seeing these situations.
Thanks. Sue, how about you?
I will go with the myth that that people who consider suicide or complete or attempt suicide are selfish and they're not thinking of other people. I've heard that a lot in my life, of people responding to other people's attempts as selfish, and they don't think about who they're leaving behind and what trouble or mess or sadness and I think that's really untrue. I think the people who attempt or succeed at suicide are in a lot of pain, and they're thinking that nobody cares about them and they don't think they'll be missed, or they just can't bear it. And so I really want people to approach the situation with compassion and an open mind, because you just really never know what's going on in someone's head.
Thanks for that. Allie, do you want to share?
Other ones is that only experts can help prevent suicide. And I think it's really important for people to know that everyone can play a role in this. It doesn't need to be someone that is a licensed clinician or provider or doctor. That if anyone comes and speaks to you about their thoughts or desires to harm themselves, that really anyone can help stop that. Suicide is the most preventable kind of death, and it just takes kind of some positive discussion. I guess it kind of goes back to what Fairwinds was saying, talking about it. I think that's really important. And so the more we talk about it, the more normalizing it becomes, and the more that people feel like open to share their thoughts and feelings. And we can have discussions about, what people can do differently.
Thanks. Yeah, go ahead, Amanda.
I just wanted to say that what Ali had shared was very helpful. And I think that we do a lot of trainings on this island. Jason had mentioned QPR, which is question, persuade, refer. And it's a training based more towards adults about the questions to ask and then how to be able to help that person and what resources are available. We also do this training to children. I mean, I've worked with children as young as 6 who have told me that they thought of killing themselves. And there's a wonderful training through Signs of Suicide where the acronym is ACT, Acknowledge, Care, Tell. And so even with whether it's a child or an adult, we can teach them different language in terms of how to be aware of the signs, what questions to ask, and then who to reach out to get for help. And what I really stress with everybody is that if this is someone that you care about and you feel that you aren't equipped to be able to reach out to that person and ask these questions, then, it's important to reach out to somebody else to be able to help that person.
Mm-hmm. Thanks. So that was kind of the icebreaker, and I'm just going to open it up to discussion. But Jason, before we went live, you had something you wanted to ask the panelists. So
yeah. So after reading this book, my mother and wife read it as well, and so we were talking about it this past weekend just to kind of prep for this, what their thoughts were, and we were in a bit of a disagreement and a kind of a fun argument, because at first I said, "Oh, okay, the library is." The metaphor is the Midnight Library, showing all these books, helping them think through the process, is the Fairwinds, the NAMIs, the ASAPs, helping them think through it, right? And my family said no. They disagreed. They said Fairwinds and the providers and mental health providers and substance abuse stops them from going to the Midnight Library. And we had a really good, fun argument. And I said, you know what? I'm just going to ask what everybody thinks at the panel, what they think. Does anybody have any thoughts? That kind of makes sense? Like for the metaphors, is the prevention and the support and recovery, is that the Midnight Library metaphor, or is it not? Or am I way off?
Anyone?
Well, I mean, my understanding of the Midnight Library, and I didn't even think about that as a metaphor, to be honest with you, but because, for her, it was the library because that was kind of her safe place and how it represented in her mind to find that middle ground. And I think for someone else, it was something different, right? The man that she met when she was in Alaska. So I saw these kind of the library and the books, the regrets of our lives, that we wish we could open up these different chapters of our lives, these different kind of starting points. And maybe more so, the family and the friends as the ones who could, when she comes back, kind of the life that those were the people that were kind of key and important in keeping her from the Midnight Library, right? As she works through it, she realizes how important these people are to her, that, to have done, one of these regrets would be her brother's death. Another was for her mother's death. Another was for her best friend's death. So I felt like all of those people played the role in kind of keeping her more from the Midnight Library. When they came, when she kind of was awake, her brother was there, her friend was there. And I think, I saw it as a little bit different.
Mm-hmm. Well, my family would be in agreement with you on that.
Oh, I like that analogy too.
They're like, you're just only seeing it through like the work you do right now, but there's other things. I'm like, okay, fair enough.
I mean, I think people can see it through both sides, and I think that, often in therapy, when we're working with someone who may be higher risk and has had previous attempts or is really struggling, I mean, I think it's normal for all of us to go back and look at the paths we've taken along in our life. And like, you may have regrets. You may recognize that, there's a reason why I didn't go that way, or, date that person. I chose this different path. And I think also just the fact that it's interesting, all the supports that she had, reminds me of the fact that, we have so many supports here on this island to be able to support somebody.
I think in just sitting here, I've thought about it both ways, and I can't decide which makes sense, because part of me wants to think that all of us doing our work are keeping people from accessing the Midnight Library. But at the same time, the Midnight Library is so rich and there's so much you can do there that, yeah, I like the idea of being guides through the library, librarians per se. We're coming for your jobs, I guess. The Athenaeum.
We're hiring.
But yeah, Jason, I can totally see it both ways. And I think that's frustrating me at this moment, but I can't decide which I like better.
Any other thoughts on that? We had a couple of people share in the chat. Anne said the library helped her see the meaning in her root life. And Allie commented, once in the library, she was able to see that she didn't want to die. So it was a healing kind of revelatory moment. Mm-hmm. I was curious how people thought about the ending. I was talking to a lot of people about the book, and someone was very disappointed about how it ended. It was kind of tied up with a bow, and to her, she didn't feel that it was very realistic. And I'm just wondering how the group felt about how the book concluded. And it was a novel; it needed to end at some point. But I'm wondering how people felt about that.
I mean, I personally like the ending and the fact that it showed hope. It showed that you could be in a really deep, dark place, and that there are people that attempt, but then they survive their attempt and are able to continue to live their lives that are meaningful lives and get the supports that they need. So I found that there was hope. And I think the fact that she also, reached out to, like, after she took the pills, reached out to that gentleman, for support, and he was the one who called 911, just shows the importance of that. You may not have your close family around, but even like a neighbor or someone you don't know as well is willing and able to be that support and get you the help that you need in the moment.
Anyone else?
I personally like endings that don't have an ending. I like to leave it open, but I don't think they could have ended that book in any way that everybody's going to like, because people are so sensitive to this subject matter. So I read a lot of reviews. I saw the 1-star reviews, the 5-star reviews. It was all over the map. And I think there could have been a nod to hope, but also left it open-ended. That's more of just like what I like in books, not particular to the subject matter.
Yeah, and those of you not on the panel, by all means, jump in. You can put questions or comments in the chat. Everyone's welcome to participate. Overall, I also think about the beginning of the book and, the notes she's writing to herself and the kind of the thought process she's going through as she's coming to the point where she's going to take the pills. And the people around her really not noticing. And can one of the clinicians or anyone really talk about how what is going on in the person's head? It seems so obvious to them, and then the world around them, it's when these things happen, it's often very shocking. Does anyone want to talk about kind of that disconnect of like what's going on in their head and how people around them are perceiving it?
Does anyone want to say anything?
I will say something. I don't know if it's totally relevant, and I'm not a clinician, but I'm going to say something. So back to what Sue was saying about the myth that people who commit suicide are selfish. not only was the main character not selfish, but I think she said she truly thought that everybody would be better off without her. So in a way, that was, caring. And she was thinking about other people because she truly believed that she was a burden to everybody.
And I think that, I mean, just from the research I've studied and also just from the trainings we do, and if any one of you have seen the QPR training, they talk about the fact that when someone is feeling suicidal or they're close to their attempt, there's a lot of warning signs that within that week before. And I think that that's, some people are aware of them, some people are not aware of them, but I think that that's the important piece around the education piece in terms of talking about this book and just talking about suicide in general, so that people are more aware of what to look out for if they're really concerned about somebody.
Just to piggyback on Sarah's, I think that's with the character in this too, is that she really did feel, and I think that's often the case with people, that that they are doing it oftentimes for the benefit of others in many ways, that they are doing it to be less burdensome, less trouble, that also nobody in the life loves them, or that they're uncared for. There's a loneliness there as well. And I think the importance of it too was that she didn't even realize how important she was in other people's lives, like the man next door who had brought her the flowers, and to the librarian that she ends up going to playing chess with, how it brightens her day. And I think it's important for people to realize the importance that they have in life, and that they may not always realize it because they are in such a depression.
I will piggyback on that and let it serve as a reminder to tell people how you feel about them. It's amazing how one little compliment, hey, your hair looks great today, or, your shirt brings out the color of your eyes, or whatever it is, that little thing can really make a difference. And it lets everybody who, even if they're a perfectly mentally healthy person, we all need to hear that we're valued, we're important to each other. So I think that little bit of kindness is a good lesson for us as a takeaway from the book.
Yeah. I mean, there's one page that I actually dog-eared because of that, because it talked about love, a fear of what she was feeling, and it was love. And she felt like she had never had it before. And she even says, even her brother hadn't wanted her in life. There had been no one. Once Volz had died, she had loved no one, and no one had loved her back. She had been empty. Her life had been empty, walking around faking some kind of human normality, like a sentient mannequin of despair, just the bare bones of getting through. And I felt like that really speaks to it in a lot of cases. When we have patients that have reported thoughts of suicide or have attempted, that really rang true for things that I hear. And just to kind of go back to that, I think it is important to share with people the importance that and the role that they play in our lives, and to make it known that we care. I just like that passage.
That was great, Allie. Thank you. I want to piggyback on both those things, what you and Sue said. It's just funny, the timing this morning. I usually go in our front office and I'll write some cheesy quote on a little whiteboard. And today I wrote, feeling gratitude and not giving it to someone is like wrapping a gift and not giving it to them. And something I saw on Instagram made me think of that this morning, which is exactly what we're talking about. We don't do it enough. We feel gratitude so often and we don't tell people, whether it's I like your shirt or something bigger, whether it's an organization or an individual. Or it's true, we all need to do it more. It could divert a lot of loneliness.
It's easy to do too.
Yeah.
I don't know. I had a question and then I forgot it, but I just wanted to bring it into like a local context. Just what's happening on the island, what you see, what people are struggling with. Does anyone want to comment? Like, obviously there's confidentiality there, but just, what are people seeing? What could we as a community be doing better to reduce the chances of suicide in our community?
So-
What Jason said.
I mean, I'm not,
Acts of kindness are the most important.
Yeah.
But I think everybody feels out of sync with COVID, the isolation. It's gray. That's what I'm hearing. But I'm not an expert. That's not my expertise. Just a community member. I'm a community member, but yeah, just even if you're a little tired and don't feel like doing something, just reach out to somebody, and which is a little off topic, I'm sorry, but I'm thinking out loud as I'm talking. Yeah, just the loneliness and isolation people feel, I think. That's what I hear.
I think there's a lot to be said about that. What came into my mind with the question was to get people to start coming back together. I know people have varying degrees of how they feel safe being face to face with people right now, but anything we can do to do that safely, I think is really important because the isolation, especially here where we have a history of being isolated. That's the people we are, and that's the environment we're in. And the more we can find ways to get back together and do fun stuff or just listen to each other. I just think that's what I feel like that's what I'm tasked with. I feel like that's what our mandate is right now, is to try to bring people together.
Yeah, I think just bringing the community together is key in getting outside. I mean, I've seen a lot of these kids, and I think a lot of adults too, like the pandemic kind of created this new form of isolation. And so many people are used to just being in your little bubble and not spending time with other people, or kids going out and playing with their friends. I think it's been a big adjustment to kind of get back into the real world and socialize. So I think really encouraging people to do that and thinking of fun ways to, get people outside and just meeting other people. I think it's helpful that the weather is getting better and it's sunnier longer in the day. But, the pandemic, over the past 2 years has really taken a toll on people. And so I think it's really important that, we reach out, we check, we ask how people are doing,
One of my, we have what we call our Nantucket families, and I'm sure all of you have the same, the people that started preschool with you or with your kids or whatever, however you met and came together. But one of my friends said, okay, when I get back from my trip, she took a trip, she was talking to us and said, we're going to start planning things. We're going to start putting things on our calendars that we're going to do. And not everybody can take a day trip. It doesn't work into their schedule, but she said, okay, we're going to take a day trip. When was the last time you went down to P-Town or something? But it doesn't have to be that. It can be anything that you know. But she said, we are going to, from now on, we're going to plan these things together and we're going to do them. And that's how we have to start again, because she said, otherwise we're all going to just keep sitting in our houses and not going anywhere. And I hadn't thought of it like that, but so now she's the party planner, she's planning, and I'll just go wherever she tells me to go. But it started that conversation. So
I love that. And just having something on the calendar and something to look forward to is just a game changer, even just knowing that you have it coming up, kind of lifts you up.
Mentioned the same thing, because she feels it too, and she travels and she can go and do what she wants, but she said, okay, that's it, we can't do this anymore. So
Great.
And being the one to do it, like my circle of friends, we've been kind of taking turns doing it, just a game night, just like maybe 6 or 7 of us, whoever's available. And we had one not last weekend, the weekend before, and a friend of ours was like, oh, like we never would have had the energy to just call you guys. So we're so glad you did this. Like it's just being willing to go first and make a couple phone calls and do the work for everyone else.
I think, living on this island, like we're so blessed to have these beautiful beaches and all these incredible walking paths. And I think, I try to get my friends out, so we can go for a walk, it's something I look forward to, and you explore different areas, and it's good for your mental health. It's good for your physical health. It just gets you outside.
Yeah.
Well, they're both tied together, right? I mean, mental health and physical health, they're connected.
Oh, yeah.
So it's really
They are.
important. The more you get out and move, the more you're going to see your mood lifts. And so it's nice. And, I'm not on Nantucket. I'm not in that community. I'm on the Cape, but we do, Gosnold does run the ESP services, the emergency service provider, and we're 24 hours a day, 7 days a week, 365 days. And I will say that, with COVID, there's been an increase, but there's always an increase during the winter months. Because it is so isolating and it is so dark and confining and limiting there. I think there's a lot less activities. So, just to your point of planning things out, getting your groups together to have some things in the future, I think is really wonderful and beneficial.
Yeah, I'd love to continue that conversation, Allie. I think, Amanda, we both saw when the time changed this year and it got darker faster. It could have been a coincidence, and I haven't seen any research, but crisis skyrocketed for us. There was I think we call it, we have a name for the two most horrible weeks we've had, was right after that happened. And I think there's got to be a connection to that and the isolation, and it gets cold and all those things happen at once and the time changes. So when I'm not a fan, I was never a fan of the time change. I'm really not now. Now I'm a big advocate, whoever will listen to me, to say like, we can't change the time here, at least in Nantucket, ever again.
I think it's actually going through the Senate and the House to not change anymore. So we'll see where that ends up. But I think it does. I think it really does, Jason, play a role in people's mood. That time change, that back and forth, definitely has an effect on people. And to your point, I don't have statistics on it, but I will say we do have an increase in calls for sure.
Yeah.
Is there a warrant article in the future if it doesn't get through the
be a home rule petition up to the state like we always do here in Nantucket. The other thing I was going to say is, and I don't mean to be critical on anyone on Nantucket or the community, but I do feel, and you guys can push back on this, that there's a reluctance to have community conversations about suicide. It's not easy. I understand why it's there. I don't know how open I am to even having it, but I'm willing to try, and I'm not really sure how to lead with that, not being a clinician. We need to have more conversations on it, but it's touchy for anybody, but definitely here because this island has suffered for, in the last 20 years and continue to, but with the clusters, and it's like, people want to have a conversation, but they want to kind of respect the families who have dealt with it. We don't want to trigger anybody, and trying to figure out that balance of having the conversations is, I think we can do it because, Amanda, when we do the QPR trainings at the school, or we did one with the town, and some with the other organizations, it's really helpful because I see people coming up to you afterwards and talking to you about it, and we get phone calls later. People are curious and they're building their confidence to talk about it. So I think we can do it, but I see the reluctance in this community, which could be in every community. Sue, you were shaking your head, yes?
No,
you could expand it to any kind of mental health crisis, whether it's substance misuse or depression or anxiety. It's not normalized to talk about it yet. And that's one of our jobs, is to we talk about heart attacks, we talk about blood pressure, we talk about arthritis. Why are we not talking about your mental health?
and I think that, just what Jason was saying with the presentations we've been doing, we've helped so many people through doing this presentation, and it's not the easiest thing to watch, and it can be a trigger for people, but it's just wonderful when people come out and reach out to you after and say, I need help, or my friend needs help. Like, what can we do? So I think the more we talk about it, the more we normalize it. you know, and that there's a lot of people, I mean, that are going through really challenging times and are suicidal, but they can get the help and still live a wonderful, productive life, you know, with it could be med management, it could be therapy, it could be exercise. But I think it's just the more we talk about it, the more we reduce the stigma and like we normalize it.
Yeah, I see him, Holly McGowan. I logged on through Holly's email she sent me. But, you know, I think some of you know me, Liz McCusker, and lost my son Quinn Christmas night, 2018 to accidental drug overdose. And I'm just getting started with trying to help people not be afraid. That's the biggest thing, because for Quinn, everybody loved Quinn, you know, and he was well into it by the time we kind of figured it out. And he went to California for treatment. And so he was there about 1.5 years. And during that time, he realized that he had nothing to be ashamed of. But before then, it was nothing but shame. And so I try my best to share with people or tell people, call me if you have a child or, you know, yourself, whoever, you know. Peter and I are here because Quinn didn't seek help because he was so afraid. And he, like I said, he was well loved, and he thought, the last thing I want is these people that love me to know that I'm involved with something so terrible. You know, and so I think the conversation, so much has happened since Quinn passed away, that through all these organizations present here today that have opened up, have opened this so much. I can't tell you. I think if all these conversations, and I know they need to go further, but I really believe if it's been talked about so much more freely, that I believe if this had happened before Quinn passed away, that he might still be here today. You know, that his fear would have not been what it was. And in terms of getting the word out, I think all of you are doing a remarkable job of helping people find some, I don't know the right word, but finding some comfort in reaching out. Like Quinn was, the two biggest things he wanted people to know, because he wanted to come back and help on Nantucket when he came back, was to not be afraid, and that their life meant something, that they were important. And so I'm hoping that somewhere I can, you know, as I do what I do with Addiction Solutions, or just in my daily, you know, if people come up to me to talk to me about Quinn, that I can share with them that the biggest thing is he found was he wished he had not been so afraid earlier. But
And I just wanted to say thank you for sharing your story. And I'm so sorry to hear
Oh,
about your
okay.
son. And I think the fact that you're speaking up and like being there and available to help, like I would love to talk to you about how we can collaborate, because I think there's so many parents out there that are
lovely.
struggling and would love to talk to a mom or dad that have been through it and can,
Absolutely.
you know, see the signs and like how to get their loved one help. So
Yeah, because we didn't see any signs for a long time.
Yeah.
And my daughter tried to share with us, and I talked to him, and he'd say, you know, Mom, I'm fine. Everything's under control. I'm not going to be a part of that anymore, because he didn't want to be. And every time he thought he wouldn't be. And he had a lot to live for. He had a loving family. He had the best friends you could ask for. He loved this community. And when he was in treatment and they would go to panels, or whether they were going to Skid Row to feed somebody or whatever, he would tell people, I come from a loving family, and it still happened to me. Because so many people in treatment, it was shocking. He said the people that had no support, he said, my family, if I hadn't had the support of my family and friends, I don't know how I would have done it. And he said, so many people are alone. And it really, you know, he wanted to help, because he said he couldn't imagine. And then there's also this thing I heard recently where someone said, well, you know, it's only rich white boys that go to rehab, or rich white people. And that really bothered me, because after Quinn passed away, and I don't want to take all your time, so I'll make this quick. After Quinn passed away, Peter and I went to get the rest of his belongings, because he and Peter had a plan January 15th to fly out, get his belongings, and take a father-son trip back across the country for a couple of weeks. So of course that didn't happen. So we went out and the boys wanted to see us that were in the treatment center with him. And it's where Margaretta Andrews' daughter, Sarah, worked, and Quinn and Sarah were friends. So we went, and it was such a mix of people, I can't tell you. And there were people that could afford, but somehow they got there. And they didn't have any family support. And I think I hate for people to feel like that they can't get into something because of the money.
Yeah.
Because I know some of these boys were living on the street before they got in. So I don't know how it was funded or what happened, but it was certainly a mix of people. It wasn't just one category.
And I
So
think,
I think that's important.
no, I think what you speak to is so important, is that we need to do better to be able to provide care to anyone, regardless of their ability to pay or their insurance status or immigration status. And,
Right.
Fairwinds is able to do that.
Right.
We spend a lot of time through grants and donations and stuff. But I hope that, with just the increase in mental health and the increase in substance abuse, that, the states do a better job at being able to give access to everybody, regardless.
Yes. Because that's somewhat of a myth. If you want to go to Malibu, yes, it's gonna, Quinn wasn't in Malibu, but there are places, and they have to know that they're available. Because I've referred people to you. I remember being out in front of the grocery store, and this young man, and I honestly don't know who it was because he had a mask on, and I still don't know, but he was talking to me about thanking me for putting in Quinn's obituary that he had died of a accidental drug overdose. He was thanking me for that. And I said, of course. I said, Quinn would have, Quinn was right here. He'd say, put it in there, Mom, because this is not a joke. This is real. And I referred this young man to y'all because he was struggling and he didn't know what to do. And I said, you can call Fairwinds right now, anytime, and they will get you in that afternoon. They will see you this afternoon. I said, and it doesn't cost a penny. They will see you. So I said, please call them, because this is an organization that will help you get on every level, will help you connect you to the right places. So I hope he did.
Thank you for saying that.
You're welcome.
That's
Holly, I just want to, sorry.
No, go ahead. Sorry.
No, I was just going to say, Holly, I felt compelled to raise my hand and to also to thank you for that. I feel like this is an appropriate audience to disclose it, but I am in long-term recovery. I am here sitting on the other side of the table. And 3 years ago, I was your son. I came to treatment on Mass Health, didn't have any resources, had a lot of family support. But I think, to me, to see this representation in community discussions and just to have resources available, I see a lot of representation about substance use disorder and about mental health on TV, like on Hulu and on Netflix and on everything. And it is becoming more of an upward trend to not only have representation, but closer to accurate representation in the media. But I think small events like this, no matter if it's 100 people on it or 13, are extremely important for people to see that they have that same representation in their community and to see that these resources are here. I think that that's very important. I can identify with what you said about your son, Quinn, prior to seeking help, being full of shame. I choose to recover out loud today because there's so many people that don't have that opportunity. And I know that that's not what works for everyone, but it is a choice that I have been able to make. And I also want to acknowledge the fact that you put that in his obituary. I think that that's very important too. It is what caused his death. I see it a lot. I'm 33. I've lost a ton of friends to both overdose and suicide. And I have always respected the family's decision to disclose that as they wish, but I feel like it feeds into this stigma when people are not honest about it. So.
Well, thank you for sharing.
Yeah,
Thank you.
And I hope the best for you.
Yeah. Joanna's been waiting to say something. Do you want to say something, Joanna?
Oh, well, okay, yes. Wait a second here. Let me take my hand down. So that was very brave of you, Keith. Thank you for sharing that. And also not Holly McGowan. I know it's not you. I'm sorry. But also very brave of you to share your stories. I mean, that's very powerful. I mean, I came to this call tonight for a couple of different reasons. One of which is that I just spent 3 months working on a group that gave grants to all of your organizations. And I wanted to see all of you working together. So thank you. I like that.
Thank you.
And secondly, I read the book and I loved it. And I thought the book was really largely about regret, right? And how you manage regret in your life. And I think that, you know, in terms of this topic, that was particularly close to home because this year I lost a friend to suicide in this community. And, you know, when I was reading that book, I thought a lot about her and about how so many people around her really didn't know how much she was struggling. And then after that happened, you know, the thing that really struck me the most was, yes, how I felt, but also how people who were closer to her than I was felt, and trying to be supportive to them, right? And trying to learn how to hold space for people who are angry and don't understand what happened. And also try to the best of my ability, get them to look at this person kindly, right? Because she was obviously struggling. And so I think that a group forum like this and the entry through a book is a really great idea, because I think you've already had 2 people, you know, share really powerful stories, right? And I think that the way a community changes is by talking about the things that affect them. So thank you.
Thank you.
Thank you.
Anna, were you going to say something? Or sorry, Allie, were you going to say something? Forget everyone's name.
No, I think I was just going to thank both Liz and Keith for sharing their stories, because it is important. There is a stigma with mental health, suicide, substance abuse. It is not the same. I think someone already said it as anything medical. You know, if someone was to break their leg or have an injury or be in the hospital, we would go, we would, you know, wish them luck. We'd bring flowers. People would bring food over to the house. It's not the same if someone has an overdose, you know, it is not treated the same. And that's really sad. But I think talking about it, and the more kind of that we normalize this and normalize the discussion, that it's important to do so, then the more that people can see the importance of how it is like any other medical condition. It is something that happens, and we need to support one another as a community, as a group. And that's how we begin to, you know, just, you know, change how people think about it and change what people do. And I also want to say to Liz too, that she's not alone. You know, Gosnold does have a group for family members. It is a free group that we provide on Mondays. And there's about 12 people that are in the group for individuals who have family members that have used substances, that have had overdoses, or for those that have passed away and kind of dealing with that. It's a really great support group, and it's for Nantucket. We do a specific
Yeah,
one.
I've heard about it.
Yeah.
Holly McGowan told me. I have to apologize. I'm not Zoom savvy and didn't know I was supposed to be raising my hand.
I didn't either, so it's okay.
Yes, thank you for sharing that with me. Thank you.
Yeah. So, but I think it's wonderful that you're available to talk to people too. Again, you know, it's just kind of normalizing it and letting people know that there's others out here who are struggling, who have had it happen to them, or are aware, and talking to one another, just caring, just being caring. And I think that's kind of what we've been talking about, is being caring to one another.
Yeah. I have a friend on island, and I won't say who because she's not here to speak for herself, but her son has been in treatment and doing quite well now. But his aunt, if you're from the north, had terminal cancer. And she went to visit him one day, and she said, so-and-so, I just wish people showed you the same compassion they show me.
Yeah.
And she said, it's heartbreaking for me. And
Yeah.
truth. And here she was, she knew she didn't have long to live, maybe a couple of weeks. And it's a disease. It's a disease.
And there is a lot of fear and shame surrounding it.
Well, look out, world. I'm coming.
Something I had a question. Something Fairwinds talks a lot about in Gosnold is there's no barrier in terms of pay. Like if you can't pay, show up anyway. That's not a barrier. But something I think of as a barrier is just the unknown of what it's going to look like when you walk in the door. I started seeing a therapist like 5 years ago, and I'm not from a family that saw a therapist. Like I just kind of hit a rough patch and asked a friend, and they referred someone. Like first time, got to kill the therapist. I still see her, but I had no idea what to do. Like I'm in there and I'm sitting on this couch and I don't know what to do. And I think people have a fear of the unknown when they don't know what it's going to look like and what the steps are. So could a couple of the clinicians kind of talk about just like 1, 2, 3, this is what you would expect if you wanted help?
I can speak to that. So I think, it starts at our front desk where people reach out and they can call or text our phone number. And then a front desk staff will talk with them and ask them some general questions and why they're seeking therapy. And then kind of will educate them about like the next steps. And the next step would be where you have an intake, which is an 1.5 hour appointment, and you're meeting with a clinician for the clinician to get a better idea of who you are. And we call it like biopsychosocial. It just kind of touches on all parts of your life. And the clinician is a conversation with, questions. And then the client is set up with therapy. Obviously, there's some people that are very resistant and scared to reach out and get help. And the front desk does a wonderful job at talking with them. And if there's, for some reason, they still are apprehensive, I will meet someone in the community if I have to. I will have them come to the office and meet with them personally myself, just kind of walk them through the process. I'll call them on the phone. I've done that with parents who are worried about their kids, and I give them my cell phone and say, call me, and let's figure out how we can get your loved one in to get help. So I think it's really important.
So good to know.
Yeah, I mean, it's just, it's a scary thing to call and ask for help. And I think that, we added the text feature because there's a lot of young kids, that's how they communicate. And there's a lot of adults that rather just communicate via text. But I will take whatever step I have to get that person in. And so, I have the ability to do that, but I think it's just really important because it is really scary, and we want people to, get that help and know what the plan is and what to expect.
That was a really good question to have answered, because with this young man that I spoke to in front of Stop and Shop, I was supposed to raise my hand. I told him that y'all, I said, it's a really great place. They're really kind. I feel like I said, I've been over there before. I can't remember why I went, but I did go for something, to drop something off or whatever. But I like the feeling of it. And I shared with him that, to not be afraid, but to know the steps that I could share with somebody and that they can text. I had no idea. That's huge. That is huge. So thank you. That's really, and to know that the first time they're there, they'll be there for about 1.5 hours, or it can be shorter if they're uncomfortable, and that you're willing to meet them maybe, on a bench somewhere and just chat for a few minutes. That's really good information to have.
I mean, we always say client choice and voice, and you're meeting them where they're at. And there are times that people come in to do an intake and they can only do so much of it, and then they'll come back. We kind of do what we have to do. And I think just walking them through the process, and the clinician does the same thing when they meet with them, kind of, this is what we're going to do. And if there's any questions that you're not comfortable answering right now, that's okay.
That's really good information. Is that information posted? It may be, I just don't know. I mean, is it posted anywhere? Is it like,
think-
like if you're struggling, you can text Fairwinds or something.
Mhm.
It may be, I just don't know.
We post it on social media, it's on our website, we put stuff in the paper, but I think you're bringing up a good point. I think it's really important that we remind people and like help walk them through the process and what to expect. And, I know the front desk do a great job at that, but that's something we can always do better.
I think the biggest challenge is trying to get somebody to take that first step. Like Amanda and I, we got a call today from a friend who's trying to figure out how to help their loved one, and they can't make them do it. But, Amanda called them and said, here's all the different options that you can do to get them to call anybody, whether it's us or the William James line or Gosnold or anybody, right? Here's, we're trying to help people help their loved ones take that first step. And that's really difficult. If we can, the chances of something good happening, if they just reach out to one of the many entities, whether it's a crisis line, the percentage goes way up that something, some kind of progress is going to happen.
I think when Quinn first went, I'm just remembering this. I think I went over to Dr. Leprey's and asked Laura Fredericks to come outside
Mhm.
and talk to her outside.
Yeah, primary care. That
Yeah,
works
that's
too.
what I did. I didn't know anything else to do, and I knew he was so afraid. And her daughter was in school with Quinn all through school, so I felt like I could trust her. And I think that is where it started.
Yeah.
That is what,
And if I can say, I think one of the good things to come out of COVID, because not really any, but the one good thing is that that it's been approved for telehealth for all insurance companies. So that really does help with some of the stigma with people that are a little bit afraid or nervous to go to any of our sites, right? To NAMI, Fairwinds, Gosnold, sometimes there's a fear of going to the facilities that people are going to see you, that they're going to know that
that
you're
was
going.
Quinn.
So I think, now that the state is kind of said, mental health services can all be telehealth, and insurance companies, no matter private or commercial, or state run, they all have to approve telehealth. And I think we have seen such a large increase in our numbers. And I don't think it's just because of COVID and what's going on. I think the other piece of it is now it's just so much more readily available and accessible to patients. So for people that maybe were nervous about, going to our sites to ask for help or show up, they now have the availability to kind of do it in the privacy of their own home, or even on their lunch breaks in their car. So I think it's really, I think that's, if I can say, one of the positive things to come out of COVID is that it has made this service more accessible. And so it's helped people feel a little bit easier in asking for the services because, maybe they are afraid to go. And again, kind of
I
that
bet
fear.
teenagers, I can only imagine, even if they don't want to share with their parents what's going on, they're struggling, that they would do that. I mean, I guess that's on social media and your website and all too.
And I think,
That's amazing.
with the influx of referrals, especially, there's so many kids that are having a tough time right now. I mean, I have to say the schools here are amazing. We get a lot of referrals from them, and we've collaborated in the sense that if we don't have enough space, the clinician doesn't have enough space to see the child in the afternoon, or they have conflicts with sports or whatever else they're involved in, then we can have the child do a telehealth visit at school, which is amazing during the school.
That's amazing.
So it just speaks to how wonderful the school is and how they recognize that these kids need help. And if it has to be done during the school day, then it has to be done then.
There's a lot of positive things I'm hearing today.
So can you talk a little bit about your work? Because your work's actually very much preventative, right?
Yes, it's tricky because it's hard to prove, that I'm successful. But so pre-COVID, we were doing a lot of programs, in person, we worked with the library a lot. We worked with the schools. We would bring speakers into the schools for the high school students. And we still do Red Ribbon Week every year in the fall, where we talk to kids and have them, do activities or projects. They make posters talking about living healthy and staying away from illegal drugs, which is hard. We've had to go through the legalization of marijuana with trying to do prevention and kind of trying to break the stigma there's a lot of myths that go with substance misuse, which has been my primary focus, about how some drugs are worse than others. And while that's certainly true, it doesn't mean any particular substance is good when used by a young person, so we've done a lot of education and collaboration on sort of the brain development through 25 years old. That's a kind of key marker. So if we can get people to not use substances before then, that really can make a big difference in outcomes. Most people who have substance use disorder started really young. I had a group, we did a PSA a few years ago that we interviewed a lot of people. We were lucky to get so many volunteers, and of all the people that had substance use disorder that came and talked with us, I think 15 was the oldest age of when they had started using. And several of these people were in their 20s, and they were sober before their 21st birthday, because that's how their process worked. And that's a hard thing to hear, that 15-year-olds and 17-year-olds are addicted to anything. And then when you think about what the world is like now, we're all addicted to our phones, and that your brain is really something you have to protect. And so we've spent a lot of time trying to do that. During COVID, I've worked with a collaborative of other organizations, and we're just trying to give kids other things to do. We've had virtual cooking classes when we couldn't get together. We're just trying to teach them healthy things to put in their bodies. We partnered with WIC, and it was a good way to also deal with food insecurity during the pandemic, because we were giving them all the supplies for the classes. I mean, I think prevention is anything that engages kids in a healthy activity. So, and I've been lucky to have organizations to work with that believe that too, that we can talk about the facts and figures and science till the cows come home. But if we can engage, especially the young people, in activities they're interested in, and that was definitely the starting point, was kids asking for certain kinds of programs. We didn't pick cooking because we thought it was a good idea. They asked for that.
That's interesting.
To learn life skills. So that was where, okay, we did resume workshops. We did college essay writing workshops. We just wanted to focus on what kids wanted to see in their future, instead of telling them what we didn't want to see in their future. We just encourage them to follow their dreams and give them tools. And that has really, it's been a lot of fun. We've learned a lot about the kids, and I don't know that we've accomplished, but one of the things we kind of had in the back of our minds, the group of adults that was doing this teen programming, was the concept, it's called like, who's your five? And the idea that every young person should be able to name 5 people that aren't a teacher or parent, that an adult they could trust. And so we wanted to, if it wasn't one of us, we just wanted to keep introducing them to adults that could be someone who didn't have anything over them. It's, your parents control your life to some degree, and your teachers have grades that they judge you on, and that changed. Me, I got nothing on you. So want to tell me something that's truthful, we can talk about it. And we just wanted kids to have other adults in their life. And so whether it was the teacher that was doing the cooking class, and, we certainly we're all, what is it called? Mandated reporters. So we're going to keep our eye out and listen for, critical things that can't just be in secret. But I think the teens got a lot from that, just knowing that adults in their community wanted to see them succeed. So that's my soapbox. I'm sorry.
That was good. That was good.
It's a great way to just, it was a great way to get to know people and introduce kids to different career paths even. I mean, we're having them talk to anybody they ask to talk to. We brought in one of the doctors from the hospital during the first month or two of shutdown, just because we wanted the kids to ask questions and not just hear the news or their parents, but like, here, you can ask this doctor. And that was amazing.
That is amazing.
That was awesome to have a primary care physician come and talk. That was great.
Now, Pauline Proch, with our house, that seems like that might be a good avenue for a lot of this. And I'm sure I've got to get in touch with her. I'm sure she's would more than welcome any of you or anybody and include some of those ideas, the things all of you are already implementing.
I can't speak for everyone, but I'm sure most of us have had a conversation or two.
I'm sure. Except me. I need to gotta call her. I have some twin beds she might want. If they need things. I need to call her for a couple of reasons.
We didn't have a hard stop, but what else do people want to talk about? Are there any other topics or anything we haven't covered that people think is important or relevant? Any other thoughts about the book? Yeah, Jason, go ahead.
Oh, I don't have any thoughts on the book. I think we could talk about this for 3 hours and just, have a lot more to chat about. I do have to go here shortly, but I wanted to applaud the library in choosing this book, right? This created this moment here where we're talking and so many other people read this and thought about it. And there's a, couple million books you could have chose from, right? And you chose this one. So thank you.
Yeah, that was a great book.
Well, good. Thank you to the One Book, One Island committee that helped choose it. So great. I have a one-sheeter on the myths and some statistics on suicide and a little bit about the QPR and ACT. So anyone that registered, I have your email. So I'm going to go ahead and send that out to everyone. It also on the second page has the list of resources for the island. So if there was something that was mentioned here today and you didn't, yep, there you go. Sue's got it. So if you didn't catch the name or what it was, it's going to be on that sheet. And you can always, I'll put my email in the chat and you can reach out to me and I'll put you in touch with whoever you need to contact if I can.
Yeah, if anyone has questions about QPR or ACT, I'm happy to talk to you offline about it.
Great.
Well, I
Well,
learned a few things, so thank you so much.
Thank you for joining.
Oh, you're welcome.
Sharon.
Anytime.
Always nice to see you, Liz.
Oh, thank you. Well, I'm here to help. My
You
husband and I
do.
are here
You
to
do help.
so don't hesitate to call. They can be here. If a parent is afraid to go anywhere, if they want to just come sit down with me and have tea and just talk about their experience, or it's a father that wants to talk to Peter and they don't want to go anywhere else, I have plenty of room. So
Liz, how do we reach you?
I'm 508-221-8013.
Okay, wonderful.
Thank you, everybody.
Yeah, thank you, everyone. Have a
Thank
wonderful evening.
you.
Thanks.
Thank you.
Thank you. Good to see
Good
everybody.
to see everyone.
Thank you, everyone.
Take care.
Thank
Bye.
you, Janet.